We'll follow up now with a contribution from Eilís Connie. Eilís is interim CEO of the Asthma Society of Ireland, previously its deputy CEO and advocacy and research manager. Eilís has worked for the Asthma Society since 2019 and has led its policy and advocacy clean air work. Eilís is an accomplished and driven external affairs professional with a history of public policy influencing in Ireland, the Middle East, Europe and the UN. She's worked in the non-profit sector for almost 18 years in feminism, human rights and humanitarian law, international development and health. Eilís led the National Women's Council's abortion rights campaign alongside its director that culminated in the Together for Yes movement and the repeal of the 8th Amendment. She trained as a journalist before entering the non-profit sector and has an MA in globalisation from DCU. Eilís, whenever you're ready, thank you.
Thank you. Good morning. I'd like you to indulge me for a moment. I'd like you to visualize something for me, and that is a family gathering around Christmas time in the sitting room, watching a movie with your family. You can see the television illuminating your children's face, and you're thinking about how you're going to pay for the heating, how you're going to pay for your child's asthma medications, how you're going to pay for Christmas. And after you put the kids to bed, you lie down yourself and you hear the familiar sound of coughing. It is your child with asthma. You listen to hear if it's going to get worse. You're that used to it and so are they. You recognise the sound of them pushing their faces into the pillow because they're so conscious of waking the rest of the family. You open the door, you see that they're struggling, their wheezing is getting louder, and you put together their spacer and their inhaler as you see their lips starting to change colour. On this occasion, the inhaler and the spacer works. You're relieved and so are they. You have a cuddle, and as you're having a cuddle, you wonder whether it was the fuel you were burning downstairs in order not to put the heating on, the mould that's creeping up the bathroom walls because you haven't put the heating on, whether it's the revving of engines from the mechanic across the road, or whether it's the reduction in asthma medication because the prices have hiked at this time of year. That is a very familiar scenario for people across Ireland with children with asthma or with asthma themselves. The Asthma Society is the voice of 380,000 people in Ireland currently with asthma. Our mission is to stop preventable asthma deaths by 2030. It's a good mission. We're working very hard to achieve it. Essentially what we do is we conduct research and advocacy on behalf of people with asthma to ensure better healthcare services for them and of course to reach for a reduction of air pollution, and I'll get into why we do that as part of our Clean Air programme. We communicate, we conduct health promotion campaigns, we provide nurse-delivered one-to-one supports for people with asthma, their families, their carers, their teachers, and even sometimes, actually quite often, their healthcare providers who are not necessarily specialists in asthma. And we do all of that through partnership and through fundraising, which takes up a lot of my time at the moment. So, along with the 380,000 people that have asthma now, 890,000 people are likely to have it over their lifetime. Every 4 minutes, someone in Ireland visits an emergency department with asthma. 2.4 million GP consultants annually are taken up with asthma. It's costing the state about 472 million annually on asthma care. Frankly, a lot of that could be prevented through better healthcare management and through better education and through a reduction of air pollution. To give you a sense of it, In 2020, 60 people died from asthma. 90% of those are considered to be preventable. So, to give you a sense of what people with asthma are dealing with, the airway on the left is a healthy airway, and essentially what happens with asthma once it's triggered is that the muscle layer tightens. I feel very conscious of describing this in front of Ian because I'm not a clinician, but the muscle layer tightens, the lining becomes inflamed and swells, and mucus can develop because of that inflammation, and that mucus can block the airways and can kill. So these are the symptoms, you're all aware of it. The issue is, I suppose, that with 380,000 people in Ireland currently with asthma, it is almost so ubiquitous as to be considered normal. People consider asthma to be normal. They'll grow out of it. Healthcare professionals, people with asthma, the general public, policymakers are all so used to asthma that we don't necessarily give it the attention it deserves and requires. Now, that's a long list of triggers for asthma. The idea of those that are highlighted in red will give you a sense of why we work on air quality, because all of those in red are related to the matter we're talking about here. NO2, ozone, PM 2.5 and PM 10, etc., are all triggers for asthma. There are susceptibility factors when it comes to asthma. So we don't know the cause, but we do know that essentially genetics matter, so they tend to run in families. So when I describe not being able to afford your medication this year, often for parents it's a choice between their own and their children's when that crops up. It is your current health status can matter, your lifestyle, your housing, your accommodation, your socioeconomic status, and now we know more about our exposure to air pollution. All of these make you more susceptible to asthma. And I suppose it's worth pointing out the socioeconomic status in particular because it is more predominant among socioeconomically disadvantaged communities. And of course, those very same communities are more likely to be exposed to air pollution. So not only are they triggers, air pollution is now known to have causal links with asthma. For PM 2.5, childhood exposure or even in utero exposure makes you more susceptible in the long term and more likely to develop asthma. And of course, the same could be said for other chronic diseases, including heart disease, diabetes, and so on. And similarly with NO2, a Lancet report done in 2019, a global Lancet report of across 194 countries, estimated that about 1,700 new cases of asthma are caused by exposure to NO2 from traffic emissions. There is, of course, growing evidence that there is no observable threshold below which exposure can be considered safe. So what do people with asthma experience on a day-to-day basis? Breda, who is very active in the Asthma Society, loves the GAA. She loves it. She goes to matches and she has to find somewhere indoors during winter to sit. The cold air triggers her asthma, but so does the air pollution. Paula is an athlete and has done some work with us too. And she talks about having to carry her inhaler and use more of them when she's out running at night and often not being able to train outside. Stephanie called the advice line, our asthma advice line this week, and I called her back to talk to her about this. She is in shared housing and her neighbours downstairs are painting. Her neighbours and she are living under quite difficult conditions at the moment from an economic perspective, and it's likely that they use cheap paint in order to get their walls cleaned up. Stephanie ended up initially with her asthma being triggered. She was struggling to breathe. She ended up in A&E. And her frustration actually isn't just that she can't control that or she can't control the chemicals, etc., used in the common areas, but actually her housing association don't take her seriously, even though her GP has written a letter to them to tell them that actually these things trigger her asthma, and there are likely other people with respiratory diseases that are being impacted too. What does the public think? So we're very proud to be involved in the Life Emerald project with the EPA, the HSE, the department and others. And we looked at public attitudes to air quality back in 2021. It's written down there somewhere. And what we found was that of all the environmental issues, climate change, in fact, is the one of most concern to those who were surveyed. Air pollution, only about 7% considered it to be their top priority, their top environmental concern. We found that air pollution is considered a much bigger issue at national level than at local level. I don't have my glasses on, apologies. Oh yes, and urban dwellers are more likely, over twice as likely, to claim that there's an air quality problem in their locality than rural dwellers. Only 1 in 3 claim to be familiar with nitrogen dioxide, and less than a quarter with particulate matter. Half of the adults claim they do not know about PM or nitrogen dioxide being some of the more predominant air pollutants in Ireland. Only 1 in 14 Irish adults can correctly identify home heating as the main source of PM. Only 1 in 5 have correctly identified diesel vehicles as the main source of NO2. 4 in 5 Irish adults agree that air pollution is a serious health risk. However, 30% incorrectly assert that the problem is restricted to our cities. Half of Irish adults incorrectly agree that when it comes to car emissions, CO2 is just as unhealthy for our lungs as PM and nitrogen dioxide. This one was around the actions that could be taken. We asked about the potential actions that could be taken in order to reduce air quality. And the majority agreed to all potential transport policy options. I'm sure the department was delighted with that. However, when it came to congestion charges, there was less agreement, let's say. More walking and cycling. So the majority of people, or a large amount of people, half, have said they've already started that actually in order to reduce air pollution and energy efficient home upgrades, which we know already are a popular option for people. So I suppose what can we learn from those findings? And really, I think we may need to go out again on that because that is really our baseline for the moment. So let's see what actions we've taken since, what effect they might have had on the population's views and knowledge. But it still means over 30% of the public doesn't know that air pollution is a health risk. That's problematic. The public might know it's a health risk, they don't really know how or why. They're willing to make changes that have a cost benefit or a health benefit to them, but not necessarily ones that cause inconvenience or economic loss. We're likely to experience greatest resistance involving those inconveniences, and also probably from rural dwellers. We know that while the department is very rightly focused on not just policy and legislative changes, but behavioural change in the population, actually there's still a large body of work to be done in educating the population around this. And we know, reflected here today, that combining climate and health issues is beneficial in terms of achieving change, in terms of moving people to take action. Some of the activities that the Asthma Society has undertaken over recent years has been partnering with DPD, for example, on a PM2.5 collection project or monitoring project, that they conducted last year and the year before. I mentioned the Life Emerald project. We've been out on the streets talking to people, mobilising with people, conducting pheno tests and so on to illustrate, the impacts of air quality. We make a lot of submissions where we can, where we have the capacity to do it, and conduct research, as I mentioned earlier, as well as through our advice line and our WhatsApp messaging service. As I say, nurse-delivered one-to-one services to asthma patients, their carers, etc. We provide information in graphic form and so on. But what we need to do into the future to remain in partnership, to push policy and legislative change, to further engage healthcare workers, to continue our research, mobilise and educate and empower. And if I might just say, on the matter of policy and legislative change, I can see my time is up. We need movement on the WHO guidelines. We need the Clean Air Strategy, and I know the department is working very hard to get that over the line, and I understand the Minister committed to that this morning. We need legislation around ventilation in schools, in the workplace, in public spaces. We need a cross-governmental approach, so it's not only the Minister for Environment, but the Minister for Health that is taking action on this and recognises the importance of it. And we need to take a human rights and equality perspective on this. We need to take an equality approach because those who are most vulnerable matter most in this instance. They are being most affected. That's it for me. Thank you for your time.